So first, I would like to ask for your permission to use this video for educational purpose and on internet and for web publishing.
Yes.
Thank you. Now, you had a very long history of spine problem. Why don't you just start telling me a little about what was the problem and how were your daily activities and how were your symptoms?
Here's the history that started in 2012 actually, and it was work-related injury fixing egg tires.
Okay.
So I had abused my low back for
Okay.
years. It was not unexpected, but L4, L5 disc herniation. Did a discectomy, laminectomy. That did not work, and did another one roughly 2 months later.
Mm-hmm. So you had
Little
multiple
bit of
surgeries.
Multiple surgeries. Thought I had better relief than the second one, and away I went. Ended up not being able to do my job anymore. Went back to school. But anytime I would be
So it
active,
really
it would flare up.
interfered with your life. It changed your life.
It would. It definitely was a life changer, and it would flare up
Not in
occasionally.
a good way.
And not just work things either. You know.
Yeah.
A real good example is we shot a deer, helped her pull a deer out of the slough, and maybe 50 feet, and I couldn't get out of bed for a week and a half.
Oh my, yeah.
So it would come and go, whatever I did.
How was the
flares like
last
that.
year before
The
the
last
surgery?
year, actually, last September 2017, I don't even have it pinpointed to what I did.
Mm-hmm.
But all those symptoms came back and worse than ever, and to the point where I was literally in bed, on bed rest, not able to do any daily functions myself.
So I'm as well, it's always a family thing, the family always suffer with us. So I'm going to ask your wife actually, what did you notice, comparing to before all of that happened and after, how was his life quality and your family's life quality in that time frame comparing to how it was, what you would consider normal?
Well, he's always had chronic back pain, and in September...
Since I've known her.
Well, since we've met, he's always had chronic back pain since we've known each other. And starting in September, it was more just a lot of his life consisted of pain management, and so there wasn't a lot that he could do and wasn't a lot that he could enjoy with the kids, and that quality of life deteriorated, and we did multiple trips to the emergency room for trying to get on top of pain management. So it was tough. It was a tough road.
So, and I see that very often that the whole family life turned around the managing just the pain. And that was the case with you, correct?
Yeah.
So where was the pain? Can you describe me where the pain was?
The pain from that would always be from 2012, through the years, it would always be mainly on the right side. If I had back pain, it was down my right side.
1 to 10. How bad?
The flare-ups would get to, at its worst, 7 or 8 over the years. Then up in September, I was up in new levels of 10.
Your 10 changed.
My 10
considered-
changed.
Yeah.
And we did the MRI, found out there was the disc was not where it's supposed to be anymore.
So now the surgery was just 5 weeks ago.
Yes.
Correct?
Yes.
I'm going to first ask your wife actually, tell me, what do you notice since the surgery?
Just he's improved his whole outlook on life, is back to setting more goals for us and for our future, and wants to, he's been more active as far as just not having to be in bed every day.
Okay.
And it's been really good.
Okay, well, but we talked about that. You're not one of those spectacular results because you had that nerve root injury that 15% of the people get after this kind of surgery. For this minimal invasive for OLLIF procedure, we have to push, in your case, 2 nerves to the side to get in. And as we discussed about that multiple times before the surgery, to push it to the side, sometimes that nerve is already irritated. It gets more irritated. But before we talk about the nerve root irritation, I want to just turn around and look at the films with you. That it shows that we did that the 2-level OLLIF procedure, and there is significant actually narrowing in the foramen there, which was there before, and that's why nerve got irritated, because that nerve was already irritated and is now even a little more irritated after the surgery. But the hardware seems actually to be in a very good position otherwise. And I think the prognosis of this nerve root irritation is actually very good. When you woke up after the surgery, you told me, let's talk about the right leg surgery that you had for years. What happened to the right leg surgery after the surgery?
After that, sir, even while I was still in recovery after, I could tell that the pain and the pressure that I had been constant, I had been used to, was gone.
Excellent.
Like, not a symptom there. It's hard to explain the feeling.
It's different.
When that pressure was gone, it was like I freed up. I could tell right away.
Okay, but you had new symptoms on the left side that you didn't have before.
Yes, basically everything to do with the quad muscle.
Yeah.
Wasn't functioning. It couldn't lift my leg up. Real strange sensations on the skin surface.
Yes, you got that nerve root irritation that we talked about, and then so that has been only 5 weeks, and obviously nerves need a little more time. But tell me, in the last 5 weeks, what do you notice?
The skin sensation has changed. Where down in this area, where if anything touched or water, it would feel like it was like a flame sensation, just the nerve.
We call that neuropathic pain. We have a name for that.
Yeah. Okay. I'll give you a layman term. But I had this. Now this is still some numbness, but every day, or I would say every week, seems to improve.
Okay.
To the point where I couldn't do regular stair stepping. I had to do good leg, good leg. Way down, I'd go bad leg.
Okay.
Now I can climb steps.
So you already notice after just 5 weeks, the function is returning and everything is getting better. Yeah, and that is as well the time frame we expect for that to happen. We say usually 4 to 8 weeks when the nerve recovers from that, and the prognosis of that is fantastic. So practically you're one of those 15% what we consent the patient for that may get that kind of nerve irritation. So you're not one of my fantastic results, because my fantastic results don't get that nerve irritation. They walk home and they're done with it.
That comes as a surprise to me. According to the way I was feeling pre and post surgery, I felt like I was fantastic.
Okay, good. I'm happy you feel that way.
This never got my hopes down. There wasn't pain. It was just lost function. You explained to me.
Yeah, because we talked about that.
It was in tough shape. We had to move the nerve, and it is improving. I can't expect anything better than what happened. Really.
Thank you. Now, before it gets better, once the nerve make connection, you may have that jolt-like, electricity-like sensation going down the leg, change the position and place and so on. So that's part of nerve healing. That's the natural and normal part of nerve healing. So just be prepared for that. When you get that, you're about 3 to 4 weeks out for the function completely to come back. Okay. So overall, any comment, anything else you want to add to that? No?
Basically opiate use. So the first time I had my injury in 2012, I was on fentanyl patch and Percocet and a long time, and had a lot of withdrawal issues. This time around, I had, prior to even getting opiates, I had tried the medical cannabis program.
Yeah.
And that actually helped a lot, kept me off the opiates.
Yeah.
Even after emergency room visit, I refused a prescription. Second time was a little bit extreme. I threw in the towel. The cannabis really couldn't get on top of it.
Yeah.
But the best thing about it was this round of opiates after surgery is I'm weaning off no necessarily withdrawal symptoms, because I have also the medical cannabis to fill in where the pain was. Well, prior to that surgery, the medical cannabis would keep the pain level lower when the opiates start to wear off, but the prescription says I can't take them for 2 more hours. The medical cannabis definitely helped to get me to that.
Your house was on fire, Your house was on fire. No matter of how much you may put a paint on it, it would just not do it. But now the fire is out.
And I was able to stay on prescription. That was important. That I knew was something different, because I couldn't, if I managed pain with the opiates, I could never stay on prescription. So it would take too many.
Now, in this country, we go always from one extreme to another. We go from one extreme that give everybody opiate, then to everybody goes crazy, and people are afraid to give legitimate pain
Right.
Opioid are
and
good
I was well
medication.
experienced in both.
Yeah.
But it came to the decision where, okay, I'm aware of what I went through with the withdrawals. I can do that again. But this time I'll be careful and not get to that point.
Yeah.
And I never did.
No, see, opioids are very good medication if you use it for anything
It was.
that's supposed to be taken for.
I wouldn't have been able to leave the hospital after being in there. I couldn't move.
And now everybody's going crazy about just let people be in pain. I just had a call not long ago from another patient who 2 weeks after the surgery, and another doctor didn't want to prescribe pain medication, and I have to say, listen, this is like, you see a house on a fire, you tell me you don't want to treat the problem, and we go from one crazy to another, but
Because you have fire insurance, you still want to put the fire out.
Yeah, you still want to put the fire out. But I think what you're describing is very typical regarding the treatment that we are talking about, that now the problem is gone. Now you're dealing with the surgical pain that needs to be dealt with 5 weeks after the surgery. You still may need pain medication, and we are going to take care of it.
Yep, a little bit.
We are going on the way
It's
down.
completely manageable. I don't have the fear of going on opiates and not, come off from that isn't there.
Yeah, and
So,
this is a new situation. But
I'm not coming out of the woods here.
But don't try to chase the pain. That is what I recommend everybody. Don't try to chase the pain, and when you need it, you just take it at a reasonably, the way and so on. And there's somebody who's looking at your back, and she's going to make sure that you don't do too much of the things that you are not supposed to.
Yeah, we even had a safety net where she would give me the opiates, basically all my pills in one of those hourly deals.
But what I'm talking about as well, about not to do too much, okay?
Right.
That's mostly that you need to watch. One of the danger of the surgery we do with the minimal invasive OLLIF is that people feel so fast, so good, that they think it's a good idea go on a jet ski or putting a swing set together or things like that.
Yeah, I actually thought about having the kids start to snowmobile up.
So you see, that's one
I know
of the
where you're
danger.
coming from.
That's one
But
of
I
the
haven't
danger.
felt as good for years.
Good.
So I'm anxious.
That makes me proud to that for you to say that. But again, there are facts of nature that we cannot change, and one of those facts of nature is bone in the spine need a longer time to heal, and because it has to heal under constant use and pressure. And even though we could in our study show that we need half of the time for the bone healing that the open surgery, but that half of the time they are still not in weeks, they are still in many months. So about at least 6 months or up. So but I think you're on a good path, and as long as you keep your good job and a good attitude toward that, I think you'll do just fine. Okay?
I'm counting it a success.
Excellent. Thank you for the interview.
Thank you.